With the number of COVID cases dropping, there's a problem left in its wake that's also causing huge problems for so many families, and that's the issue of mental health. It's a problem made worse by the pandemic, and it's even worse in the African American community. I deal with that in tonight's You Paid For It. Mental health issues have slammed every part of our community, made worse by COVID. Here's Dr. Kendra Holmes. She's just been made CEO of Affinia Healthcare here in St. Louis. She and Affinia have been on the front lines of the COVID crisis in underserved minority communities here. She says the issue of mental health is just as alarming.
Well, I think that the stress and the uncertainty of the pandemic has impacted all of us. Not only do we have to worry about ourselves being sick, we have to worry about our children, our family members being sick. We have to worry about our schools, our jobs, childcare.
According to the KAISSER Family Foundation, in January of 2019, before the pandemic, 11% of the people reported symptoms of anxiety disorder or depressive disorder. But by January of 2021, a year of the pandemic, that had shot up to 41%.
There's so many additional factors that we have right now that is causing a lot of anxiety, a lot of stress, a lot of insomnia, and especially in the Black community, which has been predominantly impacted by COVID-19.
While African Americans make up just 13% of the population, they account for 30% of the COVID cases. 1 in 3 people hospitalized are African American. They are 3.7 times more likely to die from COVID than whites. Blacks died at twice the rate of other races. And that led to greater mental health issues because of jobs without paid sick leave, higher rates of chronic disease, more grief because of greater loss of friends and family, and financial stress.
We talk a lot about the health disparities in the Black community, but we don't really talk about those mental health disparities. And we've seen increase in suicide rates for the Black community. Of course, we know well about the overdose deaths. That's predominantly for Black men.
According to a CDC study, many African Americans were not willing to seek mental health treatment because of a previous bad experience in the healthcare system. Also, a lack of providers of color kept many from seeking help, and the stigma related to having a mental health issue. According to the study, 63% of Black Americans considered mental health illness a sign of weakness.
A lot of the issue with receiving mental health services in the Black community is due to the stigma that the Black community has with mental health. And there is nothing that can be done about that stigma unless we ourselves attempt to eliminate that stigma. No other healthcare provider is going to be able to do that. That's something that the Black community needs to work on internally to eliminate that stigma.
Now, an organization of North County mayors came together weeks ago. They are hoping to attract more funds as well as experts to come together and deal with the mental health issues that have gotten worse with the pandemic. Of course, I'll keep a close eye on this troubling problem. After all, you paid for it.